Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Treatment of alcohol ingestion. If there is alcohol intoxication, gastric lavage with alkaline solution less than 2 hours of ingestion is effective. In gastric lavage is done with the help of 1 liter of normal saline and 10% glucose and 100 milligrams of thiamine is given and 15 units of insulin is given. Naloxone is an antidote for alcohol which can be given. Hemodialysis can be done. If the patient is under chronic addiction, then disulfiram or reflex condition treatment or alcoholic anonymous can be used. Investigation.
thank you and thank you for watching.